Cindy Zidar. I'm from East Bethel, Minnesota. I came to OSI actually because I needed a place to go, and within 3 to 5 days after I had a torn labrum surgery, OSI was able to get me in, and so I started here not really knowing what to expect or where things were going to go. First time through was excellent. So when I come into the door here at OSI, I am always greeted by the office staff. I mean, it's now become more like a friendship kind of environment. They all know me, they all know what I'm doing, they all know what I'm here for. They ask about just general stuff that's happening in life as I ask the office staff about that, which I like. Conversations are great. When you come back to see the therapist, if the therapists are all here, they all greet you. I love it. It's very much like a home place.
Cindy came in initially with she was post-op, the right labral tear, and so overall we started to do some stuff on the table, and she's been progressing well. We're just working on this type of strengthening first, and then now we want to transition her more to stuff she enjoys, which is biking.
I've been working with Saul. He is actually really great to work with. He is personable, he's easy to talk to. He's a teacher, he explains what we're doing. He's an evaluator, so he's always evaluating progress and trying to figure out what to do next, which he seems to always know. He's also has things in common. He's physically active, and he shares his activities that he does at home, which I appreciate too, because then you've got that commonality that you can talk about, and he does ride bike. He's got the knowledge of riding bike, so he was able to help me with just refining and adjusting to make things work better. And they're little things that have helped a lot. I've been coming here for about 4 months. When I came, I was on crutches. The very first thing I was asked to do was to lift my leg 2 inches up off the table. Could not do that. We had to come up with exercises to strengthen that hip, which basically meant sliding my foot up into a knee raised position, which I was able to do after a week or two. The thing that is when you're recovering from surgery and you're at home, you can't do things that you normally do. So most of my life was about exercising and doing the exercises, and I was doing them daily. And the thing about that was, by doing them daily at home, I was able to do different things when I came to therapy. So the progress was always very obvious, that I was getting stronger, I was getting more flexible, I was working my way through every issue that came through. And with Saul's help, it was easy. You know, it wasn't a difficult task. And then when I go home and I work on those exercises, I personally could also see the progress. Maybe not daily, but certainly weekly. I would absolutely recommend coming to OSI. I've worked with Saul. I've also worked with the other staff here. All of them are fantastic. I really appreciate the fact that not only did they take my job into effect in terms of learning what I needed to do, but they took my recreational desires as well. I'm always able to contact them via email or via phone, and they will get back to me. They'll get back to me within just a day if I have questions. I highly recommend to anybody to come here for whatever your reasons are for physical therapy, if it's about, you know, various ailments that you have in your body, or if you're trying to improve on your some kind of recreational or athletic skills that you're working with.